So as the tumor board chair, I have a sort of an organizational role in terms of making sure that we deliver high quality cancer care to patients, that they get an opinion from all the relevant specialists, that their investigations happen in a rapid and efficient way, so that no one's lost in the mix, and that they get really a international level, high quality opinion and treatment plan offered to them. Obviously, as a surgeon, I play an important role in terms of guiding the surgical management of patients with these kinds of cancers. And I also play an important role in terms of everything that has to do with clinical trials that relate to patients who have lung cancer who can have surgery. So our hospital is sort of an international leader in that regard, and we're bringing all the latest and most cutting edge treatments like immunotherapy and personalized medicines to patients who can have surgery so that they can have the best long-term outcomes. So we really have a philosophy of starting with the patient at the center of the equation. I think that part of my philosophy, and I think our team's philosophy, is to understand what a patient and their family's goals are in terms of the diagnosis they have and what they want to achieve. And then in terms of the treatment plan for them and everything that happens around that from a research standpoint, and the kinds of treatments that we're developing here, we really bridge everything from the lab to the clinic so that patients are offered the latest and the best in a way that's humane, efficient, and respectful of their time and energy. So that's really the focus, is to put patients at the center and bring nothing but the best for them. Every time I'm in clinic and I meet a new patient who's just been given or is expecting a diagnosis of lung cancer, it's very palpable, the anxiety, the fear that they feel. And it's because lung cancer carries such a terrible reputation in terms of prognosis. People feel that it's a death sentence. And I have this ribbon here that was given to me by some lung cancer survivors, and this didn't exist up until 2 years ago because there wasn't very much advocacy for patients with lung cancer. That's because up until recently, a lot of people didn't live as long as they do now, and things are really changing. So, and that's extremely exciting to see patients living long, fulfilling lives despite having had a diagnosis and being treated. So if there's anything I can say to patients out there who might be watching this, is that there is hope, and that our teams are really there to sustain that hope and to get people through it so that they can achieve a cure and go on with their lives.